Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Bromocriptine. Bromocriptine is also an ergot derivative. It is a potent agonist at D2 receptors. Okay, it is a potent agonist at D2 receptors. This bromocriptine is more toxic than pramipexole or ropinirole. It is more toxic than pramipexole or ropinirole. This bromocriptine is rarely used for Parkinson's disease because of the ergotism can occur in bromocriptine. It can cause gangrene in the toes, and the fingers can occur mainly due to the vasospasm which is seen in ergot related alkaloids or ergot agents or ergot alkaloids will cause vasospasm, thus resulting in gangrene in the toes and the foot.
thank you and thank you for watching.